Every modern college campus is dealing with an invisible crisis. Behind the doors of university counseling centers, thousands of students are stuck on wait lists, often waiting weeks for mental health support. The math of traditional therapy breaks under this pressure. There are not enough licensed professionals on campus to scale physical treatment to meet surging university demand. Operation Tar Heel bypasses traditional advertising entirely. Instead of fighting for users online, this model partners directly with university counseling centers. The university identifies students in their backlog and refers them to Eleanor's clinical practice. This allows the counseling center to provide an immediate care path for students while reducing their total internal wait times. This is the endorsed partner model. The university pays nothing to implement this. Instead, they receive a 2% wellness dividend from the revenue of enrolled students to fund their own programs. Compare this to a standard startup. A typical mental health app spends significant capital to acquire a single user. By routing through the university, that acquisition cost drops to zero. The dividend buys institutional trust and guaranteed referrals. The university waitlist is a high-yield, zero-cost acquisition channel ready to be activated. The operation launches in North Carolina, with a clinical base in Greensboro. Eleanor, the founding state licensee, pays a one-time $50,000 fee to secure exclusive telehealth rights to the entire collegiate population of the state. Selecting the first pilot campus requires proximity to the Greensboro base, severe waitlist pressure, and high enrollment volume. North Carolina A&T State University fits these parameters. As the largest public HBCU in the nation, its surging enrollment has created significant demand for counseling services. Eleanor is purchasing the specific blueprint required to build a collegiate mental health infrastructure across the state. The launch sequence begins in week 1, with the University Counseling Center referring their first 70 waitlisted students to Eleanor's practice. This specific cohort size mirrors the landmark 2017 Stanford University study. That trial used 70 students over 14 days to validate Woebot, the foundation for a $100 million company. During enrollment in week 2, every participant is handed a premium Apple or Samsung Galaxy smartwatch. The hardware tracks sleep architecture and HRV, the leading biometric indicator for stress. This data streams through an API into the therapist's dashboard. Students receive daily voice-first AI check-ins. A licensed human clinician remains in the loop, supervising the AI interactions and reviewing the biometric data. If a student completes the 14-day study, they keep the smartwatch permanently. This hardware incentive drives the high completion rates necessary for valid clinical data. This 14-day protocol produces the raw data needed for a formal study. By mirroring the trial design of the Woebot RCT, the operation gathers the evidence required for peer-reviewed publication. The daily routine relies on a physical trigger. At a scheduled time, the smartwatch buzzes on the student's wrist to prompt a check-in. This uses the Pepsodent playbook. In the 1920s, Pepsodent normalized daily hygiene by focusing on the removal of invisible dental film. We use the same framing, a daily 15-minute routine to clear invisible mental plaque. In weeks 3 and 4, these 70 students were custom-branded watch bands. These bands turn students into walking billboards for the program. Every AI session ends with an invitation to share a referral code. Those conversations about the watch bands turn into organic signups. The smartwatch transforms clinical software into a visible campus trend, driving enrollment without traditional advertising. After the 14-day launch, the collected data is formatted for submission to a medical journal. Once published, this evidence creates a clinical moat that streamlines expansion into every other university in North Carolina. To maintain her exclusivity, Eleanor must hit specific growth milestones established in the licensee agreement. The scale is significant. By the end of year 1, the practice must manage 5,000 active clients using 67 therapists. That trajectory continues to 20,000 clients in year 2, reaching 50,000 active clients and 667 therapists by year 3. To manage the patient load, clinical staff expands to 667 therapists, transforming the operation into a regional healthcare provider managed by the platform. By aligning the incentives of university administrations, students, and a clinical partner, a $50,000 investment engineers a self-sustaining healthcare empire.